So here we have a nice picture from Andrew in New South Wales, and it's a COVID-19 kit. So we've got the mask, we've got the hand sanitizer and the soap, the glasses, the tape measure that represents the social distancing. So it just reminded me of one of these old still life Dutch master paintings. So that could be the still life picture of this pandemic. Now, you're very welcome as always. It's Thursday the 30th of April already. Now, let's start off with a bit of a global perspective. And today there is some interesting developments. I think the feeling I'm getting today is we're really starting to understand more about this virus. Back in January when we started this video, we were really speculating an awful lot. Now there's a lot more that we know. But perhaps more importantly than that, we've got better strategies for dealing with the virus. We know more what to do. We've got a better pragmatic approach. And we'll look at some of that as we go through some different examples today. Now, globally, the deaths have doubled in the last 17 days. And the cases are over 3 million, and the official deaths, well, the official cases. Of course, the real number's way higher. The official deaths, 227,000. So it's a lot of people, I'm afraid. And so if we look at the picture globally, this is total confirmed cases of COVID-19 up to the 29th of April, up till yesterday. So we can see the cases have gone up sharply. But this line would have gone up even more sharply without the containment measures many places in the world have been taking. And of course, the total number of cases will go up because it's a cumulative thing. Now, this is the daily confirmed COVID-19 deaths. Daily confirmed COVID-19 deaths per million people. So in the last couple of days, we looked at some deaths in absolute numbers. But it's also interesting to look at the deaths in terms of millions of people in the population of a country. So Spain, the death rate went up appallingly, peaked here. So Spain has had a lot of deaths, unfortunately. Then Italy, quite similar. Italy started a bit earlier, of course. Italy was the first place, starting with appreciable numbers of deaths way back here in February. And the United Kingdom is here. Remember, these are the number of deaths. And of course, remember, there's always there's a delay between the deaths. So because the deaths here are dropping off, that means the number of new cases was dropping off a couple of weeks before that. Canada, South Korea, a bit of a success story. More on South Korea later on. So what this graphic tells me is that these lockdown measures are working and that the number of deaths has been reduced. So imagine Italy, for example, if there was no lockdown measures, this would have carried on increasing to really quite appalling numbers if it had been unmitigated. So this does show to me that the mitigation strategies have been effective to some extent. Now, I will only show you one more graphic today, but this is very interesting because this is deaths per million again. And we can look at different countries around the world. So basically, the darker the colour, the more the deaths. So as we would expect, we see quite dark colours in Italy. France is reasonably dark. Spain doesn't quite make sense on this graph. That can't be right. Anyway, the United States, Canada. We see quite a lot of cases in Iran here, Turkey, South Africa. You can go on there and challenge your own, do your own geographical challenge. Sweden, look, the number of cases are getting quite high there compared to Norway, for example, and Finland, the adjacent countries. So I thought that was quite a useful graphic. That's on My World in Data, so you can look at that, and there's a huge amount of data on there, keep you going for ages. Now, Patricia, Scotland, is one of the senior figures, a commissioner or something for the Commonwealth League of Countries. And she reports that throughout Commonwealth countries, there's increase in domestic and sexual violence. So this is places like the UK and many African countries. Now, this is concerning. People are staying at home and that's resulted in more domestic and sexual abuse. Now, I can't give you an answer to that on this particular video, but what I would say is think of the people round about you who you might have a concern about and talk to them if you can while respecting social distancing. Perhaps through a glass window, perhaps it's a phone call, but keep monitoring people, because I believe domestic abuse can be moderated if people know there's outside monitoring going on. So without being a busybody, you can just let people know that you're there, let them know that you're able to talk, and hopefully we'll moderate some of the sexual violence and the domestic violence that has been identified, as if we haven't got enough problems as it is. So that was really quite distressing to learn about. Now, moving on to the UK. The deaths in the UK, so the highest death rates in the US, then Italy, then the UK is coming up third. So increasing number of deaths in the UK. Now, this is with a new way of measuring deaths now, including care homes, at least to some extent. So another 765 deaths yesterday, meaning we have now a total of over 26,000 deaths in the UK, with 166,000 cases. The real number of cases in the UK now is probably around about 2.5 million, we estimate, from the London app that we looked at, that we downloaded a couple of days ago. So that's probably nearer the real figure. Now, some interesting things about the UK. Testing needs to be linked to contact tracing. Now, we talk a lot about testing on this video, and rightly so. But it's not just testing, it's how it's applied and how it's targeted. So it's not just the number of testing. It's the use that we make of the tests that we have. And that's what countries like South Korea did very successfully. They used their tests very precisely. It's what countries like Taiwan did very successfully. Quite accurate use of testing that gives real information, because the testing needs to be linked with contact tracing. So just testing someone and saying, well, you got the antigen, clear off, that's no good. You've got to trace the contacts. So there are false negatives in the test. That means some people who actually have the virus, the test shows that they haven't. So that's one factor. And we also have to have clinical observation. So it's not just testing. But what we need is more devolved action to build up contact tracing locally. So we can test every case, trace the contacts of every case, quarantine the contacts of every case, isolate every case. This is the only way it's going to be dealt with until we get a vaccine. We need a much more targeted approach. And what happens is that the testing gives us the illumination we need for that targeted approach, but that's got to be followed up with the contact tracing and the isolation. Otherwise, the testing on itself isn't that much use. However, we are ramping up testing in the UK, so there's more testing going on now. But the government plan, I think next week, to send out 100,000 antigen tests to the population, as far as I know, at random. And in the UK, the planners are very good at doing this sort of thing. They will get a very random sample. So we'll be able to test 100,000 people to find out who has the virus at the time. Now, we're still having trouble with antibody tests. Now, the Israelis seem to be quite happy with their antibody tests, but the UK government isn't. Other governments seem happy, but we still seem to be having difficulty getting a reliable antibody test. But when there is a reliable antibody test, the plan is to send that out to 100,000 people all around the country. And then that will tell us precisely how many of those people how many of that 100,000 has been infected in the past or is currently infected because they have the antibodies. And if we get that from 100,000 people that are randomly selected, that will tell us very, very accurately the total number of people infected in the country. So remember, the estimate I was working on was about 2.5 million at the moment, but that will give us that accurately, but that's not there yet. Now, there's precedent for this sort of study. Now, we reported this last week. This was actually done in New York State. The state randomly tested 3,000 people at grocery stores, shopping locations, across 19 counties in 40 locations across New York State. So 19.4 million people in New York State. And the preliminary results, based on this, extrapolating up from this 3,000 number, said that 2.7 million people in New York State have probably been infected. So that would mean that in New York State, about 14% of the population had been infected at some time in the past. And in New York City, it was higher at 21%. And this is remarkably useful information. Not high enough to give us good herd immunity, but allowed us to greatly reduce the estimate of case fatality in New York, which was encouraging, because it was looking very worrying at some stage. So the idea in the UK is to do that not with 3,000 people, but a truly randomised sample of 100,000, doing that twice. So that's very encouraging that's in hand. So we will have definitive figures. But these figures from New York, it has to be said, are pretty good. So I do believe that these are reasonably accurate figures for New York of how many people have already been infected with the virus. Now, talking about testing, precision of testing and preciseness of testing, South Korea, of course, is a glowing example. South Korea, Taiwan are probably the world's best examples of how to deal with this pandemic. And we looked at Taiwan yesterday, and we will be looking at data from Taiwan again today. South Korea cases have hardly increased, and the deaths have hardly increased, and the case fatality rate is 2.3%. Now, given that this situation has been fairly stable in South Korea for a period of time, the deaths have probably caught up with the cases, because we know that people get infected, it takes time to incubate, then they get the symptoms, and then it takes time to become serious, and then it takes time to die. So there's always this lag of 2, 3, 4 weeks of deaths behind people becoming symptomatic. But because there's been very few new cases in South Korea for the past good few weeks now, the deaths have probably caught up. So that means that the death rate is, I must say, a disturbingly high 2.3%. So the case fatality rate could well be 2.3% based on this Korean data. Now, having said that, it's probably a bit lower than that, because there will be more people in Korea have had it than have been tested. So that will lower it. But it's quite concerning. So again, we won't know for sure until they do extensive antibody testing in South Korea. And that will bring that down. How much it brings it down, we don't know. Let's hope it's a lot. But it's still, at the moment, it's a provisional number, but it is a disconcertingly high number at the moment. But it will come down. Now, no locally acquired transmission in 24 hours. So you might remember when we started looking at this, when the epidemic was starting, we noticed there was individual cases, then there was clusters of cases, then there was community spread of cases. And it's the community spread that means that it's going from person to person, and we can't work out epidemiological links of how they got it. Well, there's been none of that in South Korea for 24 hours. None of that for 24 hours. Just while I'm on the subject, North Korea, I don't believe there's been any cases at all in North Korea. You can believe that if you want. But they're not. North Koreans aren't reporting any cases. It's utterly bizarre, ridiculous and tragic. But never mind, we can't report on what we don't have data. Now getting back to South Korea, 4 imported cases that of course have been isolated, quarantined, everything. So can we defeat this virus? Yes. How do we defeat this virus? Copy the South Koreans. That would be a reasonably logical inference from their success, wouldn't it? No locally acquired transmission in 24 hours. Why not? Because they did early testing and precise contact tracing. And they used apps on their phones. They included phone records. Then emergency text alerts were sent if people were at risk based on where they'd been with their phone. More on that later today. Test, track, trace, isolate is what they did. And they have been successful. Now, there is a risk of a second wave from imported cases. This virus hasn't gone away until we've got comprehensive herd immunity. But really a great success story there in South Korea. A model to follow, that is for sure. Now, Germany. Germany's interesting. Case fatality rate in Germany is currently 4%. Now, that is alarmingly high because Germany's been testing a lot. So they've got 161,000 confirmed cases, but they have 6,467 deaths. So again, that will come down. It's a case of how much that comes down. Now, the Robert Koch Institute have just reported yesterday, in fact it was today, that their current reproductive number, their R0, is 0.75. Now, I think probably most of you know what this means. But if the R0 is 1, that means each infected person affects one other person, and therefore the numbers remain constant. If the R0 is 2, then that means each infected person infects 2 other people, so the number doubles. So if the R0 is 3, one infected person infects 3 other people, so the number trebles. But if the R0 is 0, then one infected person infects no new people, so the infection goes away. But the R0 here is not 0, it's down to 0.75. So that means on average, one infected person is infecting 0.75 other people. Or every 100 people are infecting 75 new people. So that means the number is going to go down. So if it's lower than 1, that's good news. So that's what they're estimating at the moment. Now, this is interesting because Germany are leading a bit of an experiment in reopening here. So the social distancing is continuing till the 10th of May. In fact, the Germans know well that the social distancing of sorts is going to continue till we have a vaccine. We're not going to live normally again till we have a vaccine. And the German authorities are saying it's going to take 2 weeks to tell if the degree of opening that they have allowed will be feeding through into increased cases. So the current cases are 161,000. Now, this is interesting. So what I've got here is this table here. Now, the Germans eased lockdown restrictions on Monday the 27th. Now, on the Sunday before that, there was 1,300 new cases in 24 hours. On Monday, this has been going down, of course. That's why they eased it. On Monday, it was down to 988. Now, the lockdown was then eased and the cases have gone up to 1,200, up to 1,600, and Thursday, today, 1,478 new cases. Now, the typical incubation period for this illness is 5, 6, 7 days. About six days is the median incubation period. We know it's 2 to 14 days. So we're not going to know if people were infected then when the lockdown was eased, 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 until they've incubated the virus and developed symptoms. Of course, the big risk that Germany is taking, and Angela's very well aware of this because she's very anxious at the moment, the big risk that they're taking is if many more people become infected as a result of easing the lockdown, before they become symptomatic, they're going to infect others because of this pre-symptomatic spread. So basically, we're watching Germany with bated breath for the next 2 or 3 weeks to see if this has worked. And if it hasn't worked, and if more people are getting the virus and they've spread it quite widely before they've developed symptoms, then we could see another very, very steep growth in cases in Germany in about 3 weeks' time. 2, 3, 4 weeks' time in Germany. So is the German experiment going to work? Everyone, of course, hopes so. I'm optimistic because the German population is now well trained. They know They don't hug and kiss, shake hands, social distancing. They know all that. They know about wearing masks in supermarkets. They know about not sitting next to someone on a table in a cafe or a coffee bar. So the population's well educated, so I'm optimistic. I'm pessimistic because this virus is very transmissible. It's not that hard to catch. So the German experiment could go either way. At the moment, we simply don't know. Now, the Germans are doing very well on testing, getting on for 1 million tests a week, so well done. Nearly 500,000 tests carried out last week, of which 5.4 were positive. Now, I think I'll do the Czech Republic and Russia, and then we'll leave it there, because if these go on too long, they don't upload properly. My rubbish internet connection. Now, Czech Republic, cautiously reopening, a bit further to the east, of course. Below 100 new daily cases for the past 8 days consecutively. So that's very encouraging that their cases are down because of the social distancing. So really, they're in a very similar position to Germany, really. So the cautious reopening, again, we're not going to know how many new cases that will bring about for 2 or 3 weeks. Is it going to bring about more cases? Yes, of course it is. Are some of those going to become sick? Maybe 15% of those going to become quite sick? Yes. Are 4 or 5% of those going to become critical? Yes. Are maybe 1% of the total people that catch the illness going to die? Yes. That's known. But we can't stay locked down forever. It's estimated in the Czech Republic that the reproduction rate of the virus is 0.7, so the R0 is 0.7. So again, on average, 100 infected people infecting 70, so the numbers are going down. And one of the health ministers has said, so far we do not see a negative trend resulting from previous relaxations. In other words, they've had relaxations and that hasn't caused a great number of increase in cases. Again, in the Czech Republic, the population are well educated and will comply with the requirements. We will proceed with caution gradually in the upcoming waves, and I believe we're on a good path. So again, a bit of an experiment. We're not going to know for sure, but what they're saying in the Czech Republic is so far it does seem to have worked in their particular situation. So let's hope for the best in that situation. Now, Russia is a concern. It has been from the start. Record daily increase in cases. So on Thursday, today, there was another more than 7,000 cases in Russia, taking the total up to 100,000. Of course, these are just confirmed cases. The real numbers are way higher than that. The deaths are starting to increase, and the deaths doubled in the last 8 days in Russia. And I'm afraid they probably will do so again. So quite a sharp increase in the cases in Russia, really. And just seeing we're in that part of the world, we'll have a quick look at Poland. So in Poland, hasn't been too badly affected, Poland. The measures do seem to be working in Poland. They've been locked down since the middle of March. Now, part of the reason for they've been successful is that everyone has to wear masks, mandatory mask wearing. Why everyone doesn't do this in public spaces, I have no idea. And I was going to do it this video, but we've taken up a bit too much time. But in the next video, I'm going to look at some very good scientific data that gives evidence for the efficacy of wearing masks in public spaces. So people in supermarkets and things wear masks. They maintain social distancing. And this is not being done in the UK. They're using hand sanitizers or gloves in shops. So public spaces like supermarkets, public transport, shops, people need to wear masks so they don't infect other people. There has to be hand sanitizers everywhere, and people need to wear more disposable gloves. And that seems to be working in Poland. So again, let's learn from the lesson of Poland. Now, I've got quite a lot more to do today. I've got Australia and the United States still to cover. So another couple of interesting new developments. So I'm going to leave that there for now because I can't make them too long. Otherwise, it won't upload. So we'll come back soon. Thank you.